Okay, so patient's position here in the modified CRAS position. I should expect to see laterally is here. This is medial. We're long axis, so again we have that deltoid muscle and the pinnate appearance. Here's that peribursal fat. If I continue, that's going to always keep going past the greater tuberosity. Here's that footprint I mentioned on the greater tuberosity. Here's the articular side ending at the anatomic neck. And you can see that compact fibular appearance of the rotator cuff at the supra. And those are those three surfaces I mentioned, the intrasubstance, bursal surface, and articular surface that'll come in handy when you're doing your pathology lecture and talking about partial thickness and full thickness tears. So here we're oriented on this part of the shoulder here. You can see that when we are far anteriorly, the supraspinatus tendon has more of like a bird's beak appearance. The greater tuberosity has more of an angle here, and as you go more posteriorly, getting towards the infraspinatus at that middle facet, it is going to flatten out a bit. So superior facet has more of an angle, almost like a bird's beak appearance here, and as you go more posteriorly into the infra, you'll see that will start to flatten out going into the infraspinatus and into the overlap region. So again, long axis, make sure to start way, way anteriorly or medial and identify this structure here, which is your long head biceps. That's important for two reasons. Number one, I'm going to make sure I don't miss any of those far anterior supra tears, those so-called rim rent tears, and also make sure that I'm oriented correctly. So if I see that tendon nice and fibular here, I know that I'm oriented correctly with the supraspinatus. So we're going to play this. You'll see anteriorly, more of an acute angle, kind of bird's beak appearance, and as I go more posteriorly to the overlap of the supra and infra, you're going to see that it flattens out as I get more into infra. So even though all these structures are labeled, for example, this is labeled supra, modified means that modified CRAS, long axis, I am seeing a decent chunk of the infraspinatus as well.